Good afternoon. Good afternoon, and welcome to this workshop. Welcome to the 6th Annual Pathway to Hope Conference. My name is Davila, and I will be your workshop session moderator. Please share your first name and zip code and any speaker-specific questions and comments in the Q&A box on the lower section of your screen. Again, welcome to everyone, and let's get started with a little housekeeping. If you are attending the conference to receive Continued Education Units, or CEUs, please listen carefully. All registered attendees seeking CEUs must remain in the session for the entire duration. These sessions are approximately 75 minutes long, and so you can accrue 1.25 CEUs. Approval in the areas of CPC, LMFT, social workers, and psychologists. Each attendee can qualify for a total of 4 CEUs eligible workshops that have taken place Friday and through today, Saturday. A post-session survey is required as well as a daily conference evaluation. For those joining us out of state, please follow your CEU instructions. However, it will be your responsibility to seek final approval from your state's credential board. We are grateful to have the support of NAMI, Texas, and the Bexar County Recast Project for making these CEUs available. Again, all registered attendees seeking CEUs remain in the session for the entire duration. So now it is my pleasure to introduce to you our speaker, Dr. Zoricelis Davila, for our family, mental health, and Hispanic community workshop. She is a licensed professional counselor with a private practice in Fort Worth, Texas, serving the Latino community for 18 years. She is a graduate of Southwestern Baptist Theological Seminary. Among her specialties are working with victims of trauma, violence, crime, sexual abuse, intimate partner violence, and women issues. Latino population specific issues, depression, anxiety, human trafficking, and other mood disorders. Dr. Davila has served as a volunteer collaborator for the Spanish division of NBC Universal, for the Spanish division of NBC Universal and Telemundo Dallas and Washington, D.C., educating the community about mental health issues, crisis, suicide prevention, trauma, and other topics. Additionally, she is a radio co-host for Radio Manantial in Yuma, Arizona, speaking and educating the community on issues of mental health, marriage, and family. Join me as we welcome Dr. Davila.
Thank you, Odelia, and welcome everybody. I am so excited to be here with you, and I am thrilled to have you at our workshop. Even though this is a webinar, you'll soon find that we're going to be interacting. So we have our chat. I'm going to be asking you questions, and I want you to just write those comments and those answers in the chat box, or we're going to be interacting. So welcome to La Familia. This is the Hispanic family and mental health, and we're going to focus on breaking the stigma and finding support. And I added, because of where we are right now, the impact of COVID in our familia. And oh my goodness, there is so much to talk about. And I want you to feel free to share. Like I said, I'm going to be asking some questions. So thank you. And thank you for welcoming me. And I'll be looking at the chat. Thank you for everybody who's coming. Lauranda, Ariana, and everybody. Just La Familia, you know that we are a collectivistic group. And just to give you an information, not that it's needed for the workshop, but I think it's going to be fun. I'm in Fort Worth, like Odilia said, I live in Fort Worth, but my family and I am from Puerto Rico. And NAMI had invited me. I said yes, we had the date. And a couple of months ago, my nephew says, Titi, because here in Puerto Rico, aunties or tias are called titis. And he said, Titi, I'm getting married. Yes, I'm happy. When is the wedding? The 26th, which was yesterday. So I had to make everything happen to be with La Familia because La Familia is important. So I want to ask you, if you're a consumer or if you're a provider, if you could put on the chat consumer and what is your main objective for this workshop, or if you're a provider, what would you like to hear in this workshop? And while you write that in our chat box, I want to ask, if you're a consumer, I want you to give me a quick phrase or quick comment of your personal experience with mental health during COVID. And if you're a provider, then what has been your experience as a mental health provider managing clients during COVID-19? Thank you, Melissa, your provider and how to be culturally inclusive. Thank you. Thank you for saying that. So I want to hear, if you're a provider, how has it been your experience over these pandemic times as a mental health provider? And if you're a consumer, what has been your experience? As a provider, I didn't know what to expect because none of us have experienced the pandemic before. And I thought for a moment, well, maybe this is going to be slow and I don't know. I was busier than ever in my life. I was working from home on the computer, but oh my goodness, I was working 14, 16 hours nonstop. And something completely new for me that before my Latino families were completely adamant against doing telehealth. And during the pandemic, they were all, yes, I need you. It doesn't matter if it's in front of a TV, I need you. So that was a definite change for these times. I see Linda always working on insights and culture. Excellent. Mary, leader for NAMI, welcome. Yes, you're so okay. So thank you for sharing that because we're going to talk about the isolation that children experienced. And I would love for you to share that as well. Absolutely. Them having the connections. I had a client, she's a 12-year-old, and now who's coming back to the office, she's telling me that she was ready to come to school because she couldn't take it anymore. She couldn't learn. Both, Annalicia, both. Welcome, Annalicia. I think I have seen your name before. And if I'm making it up, then blame it on mental health. And if I did well, then definite welcome and thank you for sharing. What else? Okay, provider Tammy, thank you. Absolutely, absolutely. Juvenile court case manager, thank you. We've had quite a significant increase in cases with juvenile delinquency for different reasons that we're going to address. Provider observation, excellent, the isolation. And that is exactly what has been having. Your son, Mary, thank you for sharing, living in the community. Yes, and the truth is also that we have had some challenges finding availability with psychiatrists because everyone has been booked. Jessica, thank you. You're an LPC, welcome, thank you. Excellent. Working, yes, since April 2020, yes. It has been exhausting in both sides, like Jessica is saying. absolutely something we have never seen before, and that it has been affecting mental health ever before. So even though our demographics, in terms of the Latino family, if we go to the research and our demographics, demographics say that Hispanics are more than 17.6% of the US population. And when we talk about mental health before COVID, depression was one of the leading causes of disability. This is before COVID. Before COVID, we had 1 in 10 Hispanics using the primary care physician for mental health. Also, this is all before COVID. The Hispanics reported higher rates of most psychiatric disorders than Hispanic immigrants. But after COVID, all of that changed. And we're going to see that. And I want to share a chart in a second. Thank you, Jessica. Yes, psychiatrists seem to have been, they have vanished. But what I have experienced on my end, at least in North Texas, is that they were overwhelmed with cases. They were completely booked. I have one of the psychiatrists that I work collaboratively with. He allows me to have his cell phone number. And he said, I called him one day and I was surprised he was answering. And he said, yes, I saw it was you. And I just wanted to let you know, I'm working, I'm booked. I cannot take anyone else. Not because I don't want to, it's because I just don't have the time. And he said a phrase that I have heard from other clients who are physicians. And he said, I am so overwhelmed. I don't know if I will continue to work on this field anymore. And he said it, you could tell he was hurting because I know he loves psychiatry, but it is the nature of the situation. Oh, thank you, Sandy. Sandy's a retired social worker, but she loved the topic. Thank you. I'm not ADHD. I just want to keep a balance between the chat, having you. I want you to feel included, and also I want to share this information with you. So going back to the story I'm telling you with the psychiatrist and other physicians, I began to receive calls from physicians who were naturally overwhelmed because they were working insane amount of hours dealing with COVID patients. And then some of them began to tell me, I don't know what I'm feeling. What I'm feeling is something I have never felt before. And when they described what they were feeling, I began to hear anxiety, being fatigued. And naturally because of the work that they were doing, but because they had never dealt with any mental health issue before. And so this is what COVID brought. It put a spotlight on mental health, not because it wasn't there before, it has always been there, but because we began to deal with issues we were never dealing with before. So I want to share with you briefly. I know we have some questions and answers, and I'm going to come to them after I share these with you. Host disabled participant screening sharing. Okay, not a problem. I don't have the ability to share my screen, apparently, but you will have access to this presentation. Okay, so this is what I want to share. In terms of anxiety, we encounter a 31% increase of symptoms and also a 26% increase of reports of trauma and stress-related disorder symptoms. 13% increase in this is all from CDC, in clients who began or increased their substance use, and 11% increase in suicide ideation. So I want to pause here for a second. When you hear these numbers, what comes to your mind? And while you write on the chat, I want to share other stats. Between 2019 and August 2020, The prevalence of symptoms of anxiety increased from 8.1 to 25.6%. Can you imagine? That's 2 times more than what we had in 2019. In terms of depressive disorder symptoms, the prevalence, 4 times more, from 6.5 to 24.3. That's anxiety and depression. Suicidal ideation, get this, from 4.3 to 10.7. And I agree with Mary. Mary's not surprised because what happens is that when people feel extremely overwhelmed and their natural response looks to cope, and at the moment they feel so stressed they don't feel the energy, or they don't immediately have the coping or strategies or the support system, sometimes the immediate response would be to consider suicide. It is sad, very, very sad, but that's not all. In terms of symptoms of trauma and trauma-related symptoms, 26.3 increase. Now, I have heard people ask me, why trauma? Well, I don't want to traumatize you now, or I don't want to re-traumatize or activate any symptoms, but just go for a second to March of last year. Suddenly, in every TV, the news was pandemic, we're closing, danger, death. Well, what does that create? Tell me in your chat, what does that create? Fear? Absolutely, Rebecca. Fear. Terror? Yeah, anxiety and fear. Reverend B. Smith, thank you. Panic. Tammy, thank you. Yes. Panic. Oh, of course. It is traumatizing. And then everything you begin to hear is death and numbers rising. Uncertainty about the future. Thank you, Mary. Just not be, and then for the Hispanic family, and I think this was for all, and we're going to see those numbers in a minute. It doesn't matter if you're Hispanic, white, Black, Asian, from the Middle Eastern, your life changed and suddenly you are isolated. And so for everyone, that created a certain level of trauma. In my case specifically, I happened to had COVID in January. And of course, I was very sick. And at one point, I couldn't think, I couldn't read, I couldn't hear anything. It was just too overwhelming. And I thought one night, well, let me turn on the TV because I couldn't tolerate noises. Let me turn on the TV and see if at least I can get my head in a different direction than just dealing with my symptoms. Well, I turn on the TV and all I hear is so many deaths and so many deaths and so many deaths, and I have COVID. I had to turn off the TV and access my support system because I really thought I was going to lose it. And that was my experience. And I have a good support system and good coping skills. What about those of a more vulnerable population? What about those who don't have a family system or a coping family support immediately? And at that moment, everybody is saying, get away from everybody. So if you're single or widowed, or if you're living by yourself, you're isolated. What happens when you're depressed? You withdraw. But in this moment, many people were not depressed and they got depressed. But if you were depressed, then depression increased. And of course, it deteriorated. So that is significant when we deal with breaking stigmas, because remember that by then, we're still dealing with the stigmas associated with mental health. And now we're dealing with something we had never heard before. And Jessica shared that she started watching the news daily. Yeah, uncertainty and confusion became skewed from misinformation. Absolutely. Absolutely, it affected everybody. So when we're talking about stats, I want to go back to the substance abuse. Reports say that 13.3% started or increased to cope with the stress and emotions related to COVID. And all these stats are related to COVID. Now, I want to ask a simple, silly question. And I say it's a silly question because the answer could be obvious. But is mental health culture and ethnic specific? What would you say? Is mental health culture and ethnic specific? Absolutely not. Thank you. Thank you, Reverend. Thank you, Linda. It is universal. Absolutely not. And I want to share, I think I have privileges now to share. I want to share this chart with you. PowerPoint, share, and I want to share. This was the initial, let me make sure that I'm, okay. Can you see the?
Yes.
Okay, excellent. Thank you, Adelia. Since I put this chart, I cannot see the comments now, so I'm going to depend on you. So this is the chart that the CDC published, but I want you to see this table. We have different ethnicities and people groups and cultures. And can you see the numbers rising in anxiety, in depression? And this is all COVID related, okay? This is absolutely all COVID related. Look at this number, trauma. Look at the Hispanic population, 35.1. And there is a reason for that, and we're going to talk about it in a minute. Look at these COVID-related stressors. Every group, the Black community, the Asian community, it went from 23 and 24 to, it went from 14 to 22, the Asian community. I want you to be writing in the chat while I share a little bit about this chart. So when I go back to the comments, I can address them. What do you see in these numbers? We have different groups, different backgrounds, different ethnicities, and we have a consistency in anxiety, depression, trauma and stress-related disorders, increase in substance abuse and suicidal ideation. Oh my goodness. Oh my goodness. So I want to hear your thoughts about that. It is absolutely global, which means mental health is an issue we need to address. And we need to consider all of the factors associated with that. Exactly. Thank you, Tammy. She says that you also have to factor in the civil unrest, the natural disasters that occurred within the time of COVID. Absolutely. The financial stress, because now a lot of people are not being able to go to work. And if you had a family who had already large amounts of debts or financial challenges or other challenges, and then you have them in this scenario, of course, that's going to be even more. So what happens is, Mary says, it's interesting to me that the numbers were high, but higher with minority groups. Yes, absolutely. And why do you think that is? That's an excellent comment, Mary. Why do you think that is? That with minority groups, the numbers are higher? Ta, 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 ta. I want to say there is an explanation. Absolutely, because during that time, they were facing increased discrimination. Asians, Rebecca is saying. Thank you, Rebecca. Economics and lack of access to help. Yes, because we're going to talk about those barriers to access assistance and services. And absolutely, thank you, Annalicia. Minority groups do not have the same amount of access to resources. And when you factor in language, Asians, definitely a portion of the Latino community, those who are more predominantly Spanish speakers, other like the Middle Eastern group, other minority groups that have challenges with language. Not only they don't have enough services in their language, but there are other services that they're just not available to them, period. If you factor in also lack of insurance, health insurance, I'm saying. So all of that. When it comes to the Latino specific community, which is what we're addressing a little bit more, then we need to look at the culture influence. And Lauranda, I don't want to mispronounce your name. Lauranda Garza, thank you. Cultural discrimination, absolutely. So in relation to the Latino community, we have four cultural concepts that influence our response to our everyday life. The first one is called familismo, which is the concept of that we are family oriented. Family is first. What is it that I share at the beginning? You know, I have a conference, but I have to be from my nephew's wedding, and I had to do whatever I had to do because our family is first. And that's the way we function. It's funny. I say it's funny because it's funny to me because I lived through that. As a provider, my office has a small waiting room. You can barely fit 3 people because my office is a little bit larger. I do the work in my office, not in my waiting room. But when my Latino families come, the abuelita come, the aunt, the uncle, and if it's spring break and someone is taking care of the children of someone else, I have had families come with 9 children and the abuelita and the uncle, and sometimes I have to say, I love you all, but just please don't bring anyone else to the appointment because they're not going to fit in my waiting room. But they understand. But it is because family is first. Interestingly enough, with research supports consistently that the positive influence of family dynamics support and alleviate depression, anxiety, and it helps those patients with mental illnesses. And we're going to talk a little bit more about that later, but familismo. Latino community is not the only one who has that family-oriented concept, but it is recognized in the culture as the significant factor to help. Now, let's talk about other cultures. There are other cultures that are group-oriented, collectivistic type of environment-oriented, or they're just family-oriented, period, or matriarchal-oriented. I know there are other minorities where the mom or the grandma are the matriarchal of the family. If you have any comments about that, feel free to add it because I would love to mention it. So also in the Latino community, we have machismo. And machismo is a whole other concept for another conference, but I'm just going to devote a couple of minutes because we could get into deep waters. But the machismo is that, let me be careful with the way I present it, is that belief and that concept. It's not only a belief, it's the concept and the value that the man of the house is the responsible for the family. And so you do what he says, and he has the responsibility to provide for the family, and he has the responsibility for the well-being of the family. And I know that the concept of machismo has been misconstrued and misused, and it has been used differently than what is intended to. That has created other conflicts, and we're going to talk about domestic violence in that sense. But it is a value, and it is the value that the husband or the man of the house has the responsibility to protect and provide for the family. So that is a significant factor when we talk about depression on men during pandemic. because the men take honor and respect in working. What happens when you tell a man you cannot work anymore and you have to be in the house with the woman and 5 children? Do you know what happens? You can write it down. And while you write down those comments, I want to read Reverend B. Smith said COVID attacked the family resources and COVID showed lack of equal access to healthcare. That is completely correct. And yes, family violence. The numbers in family violence increased in numbers that were alarming. In our area, we have Cook's Children's Hospital, and we were having numbers even with incidents where children were impacted by family violence increased more than ever before, to the point that physicians went into the news and just plead for help and assistance from the community and just managing these crises, because their hospitals were just, all their beds were completely full, not only with COVID-related issues, but also with incidents of family violence. Tommy says lack of power with not being to work and depression, and that's what it is. They did not have the coping skills to manage something they had never managed before, because in this case, it was not that they couldn't go to work because they didn't want to or they were sick. It's because they were told not to. And they were like, okay, I'm home. I have to provide for my family, which is one of their values of their culture. I have to protect my family, which is another value for the culture. And they couldn't do either or. So that definitely influenced the levels of depression. Now, let's talk a little bit about Compadrasco. Okay. There, I could not find an English term for Compadrasco. But Compadrasco, and maybe you have heard the term comadre or compadre, it comes from the Catholic Church, where when you baptize a child, you choose two trusted adults who you would trust your child to if something were to happen to you, and then you take on the parental role of for that child. And so you're called compadre or comadre. And I mean, let's say you are very healthy, but you're always compadre or comadre. It's like a very close friend. And in our Latino community, friends are like family. And, you know, children discover godparent. Thank you, Taylor. Thank you so much, godparents. I'm in Puerto Rico today, so my English and my Spanish are fighting to leave my mind here. Thank you, Taylor. They're godparents. So you will always be comadre or compadre. And so if you have a close friend, that friend becomes an aunt, or that friend becomes an uncle. So our family, it's already big or large, and we make our family even larger with family and friends. So what happens? We care for our families who are sick, but we also care for our friends who are sick during COVID. And what about the comadre? How can I help you? What can I do for you? And people who were sick with COVID, they would bring maybe something and leave it on the porch, a soup or bread or something, because we couldn't see each other, but at least you had friends who would make you feel loved just because they were dropping something. And another cultural influence is what we call dignity and respect. For the Latino community, dignity and respect is very significant. But all that dignity and respect comes from also performing, being able to provide, being able to care for each other, being able to be there for each other, being able to be present. And then COVID comes and removes all that. So what do? Even your support system is no longer physically present, because we're very huggy and touchy and present. And now we're entering into a virtual world. All of that were factors that increased significantly depression, anxiety, and stressors and trauma-related symptoms. And yes, Mary says Zoom was a way for us to connect. And what we found is that Zoom became that Zoom and FaceTime became the tool for us to be able to connect with each other. In my case, I live alone and my family lives in Puerto Rico. I live in Texas. And so for my family to make sure that I was fine, they would call me on FaceTime. I couldn't speak. I could only make noises or signals, but I could have my phone in front of me and they could ask me questions and I could say yes or no. And it was sweet because my aunt says, who's going to take you food? Who's going to feed you? I'm not there to feed you. But it's because family takes care of family. And when we're sick, we take care of each other. Let's factor in mental health. When we're depressed and you have a family member who wants to be there for you, but cannot be there for you, how do we handle depression? How do we handle anxiety? So we had to provide other alternatives and be creative to find ways to make sure that our family was going to stay connected. Let's bring the stigma now into this conversation. What happened with stigma during COVID and this scenario that I'm presenting to you? I want to see your comments. I'm going to get some water here because it's getting hot. What happened with stigma? And with stigma, the truth is we have stigmas everywhere because it refers to the attitudes and beliefs that lead people to reject, avoid, or fear those they perceive as being different. So what are some of the comments you hear when someone says, well, I have depression or I have anxiety, or I have a family member who happened to have a schizophrenia, or someone says, oh, I had a family member that had bipolar disorder. What happens when you have in the family, or you even have a mental health disorder? There is a stigma, but now you need help more than ever before. Mary says, I think there is more awareness about mental illness now because of the people speaking out and media bringing it up. Thank you. Thank you, Mary. I want to share something about that. Like Odelia was sharing in my bio, I collaborate with Telemundo, and they're always consulting and bringing me to collaborate in a volunteer basis about topics on mental health. During COVID, I had presentations in the newscast every single week, 2 or 3 times. It was more than ever before. And I've usually have maybe once a month, twice a month, but during COVID, between March and November, it was every single week. We even had a specific an hour devote to mental health and people calling in and having live questions on TV. So yes, we're speaking about it now even more. Cara said, I'm seeing that COVID has really led to more open conversations, correct, regarding mental health and resources. Yes. So as terrible as the pandemic has been, and it has been terrible, we can say, and I want to dare to bring the Bible, you know how the Bible talks about that everything collaborates for good. And the good about this has been that now we can talk about it more openly, like Kara was saying and Mary was saying. Yes, Odelia, thank you. We were all in it together. Yes. All were full of mixed emotions, needed to talk about what we felt. Yes. I am not going to advertise for any particular application, but I discovered during the pandemic an app called Marco Polo that is a video app. And it's the same like WhatsApp, but it's on video. And a friend of mine sent her to me, and she would send every day a video to check up on me and to make sure that I was fine. And it was a live person rather than a text. So we loved it because at least we could stay together. And then we could be, now when I got better, because we got COVID around the same time and we couldn't speak first and then she couldn't speak later. But we have that application and she could say, and I feel this and I feel that and I feel this and I feel that. And I could be taking a nap because I was exhausted when I was sick. But then when I woke up, I could see her video. So yes, we had to share. Ariana says, in my family, it was not addressed. I am so sorry. We were just being chifladas. Oh my goodness. Okay, so it was not addressed, but I'm sorry because it could have been a great opportunity to share. Mental health, we need to begin to learn to talk about it more, but we need to begin to demystify that. And I'm going to share some myths with you. We need to talk about it. We need to share. We need to. How do you feel when you are expressing your emotions? And I felt frustrated, I felt sad, and I felt this and that, and you keep sharing, and then you cry, and then you maybe scream, oh, I don't know what to do with it. And then that ends, and you're like, you breathe, don't you? You sigh. That is because there is a neurobiological effect. When you're expressing your feelings, when you're talking about what you feel, you're releasing all of those emotions, and your brain organizes information, and then you begin to organize your emotions as well, and then you are feeling more relieved. It's therapeutic. Talking and expressing your emotions is therapeutic. I may not be able to solve your emotion at that moment, but I am able to hear you. And that's already going to be therapeutic for you. So we need to demystify the stigma. And we're going to see that in a minute with a chart that I have. Any other comments before I continue? Mary says that she's naturally pretty calm and controlled, but occasionally everyone needs a good cry. Absolutely. Sad movies can be therapeutic. I am with you, Mary. And I want to share something else about that. Do you know that tears have the hormone of stress in its chemical compound? That's when you cry so much, you're like, of course, all those chemical compounds are in the buckets outside of you. Absolutely. Thank you, Ariana. Correct. Now, finally, me and my cousins were able to speak about anxiety and depression as it was not discussed in our familia. It is true. It is a stigma. It was not discussed for many families before. Another issue with stigmas is that there is a public stigma. What have you heard? What is the common phrase you have heard about mental illness in the public? Oh, that person is. In Spanish would be loca o loco. In English would be crazy. I have people sometimes that tell me, please tell me I'm not crazy. And I said, of course you're not. You're hurting. You're in grief. You're sad. Crazy, dangerous, insane. Absolutely. Thank you, Mary. Yeah. And the consumer stigma at times, it says that they're special, they're different. Or in the Hispanic community and in Spanish, they call it, oh, está malita. She's malita means there's not a justice in this translation, okay? It's like, oh, she's bad. But it's not bad as mean. It's just, oh, she's not well. And I say, she's not well? What do you mean? She's sad. He's anxious. She's worried. She's struggling with with an illness. This is not a capricho, or this is not something that I want to have. I did not choose to have this. This is something that is naturally happening. Now, when you talk about diabetes, you don't say they're crazy. Oh, diabetes, oh, you're crazy. No, because mental illness is something you cannot see. So people or the community tend to put labels on it. Something that I say about breaking the stigma is, well, let's think about it for a moment. Do you walk without your head? No, right? Your head is part of your body. Your brain is part of your body. How come it is okay to say that you have diabetes? Oh, go to the doctor, check your A1C. Oh, yes, you have high blood pressure. Oh, muchacha, go and walk. 30 minutes of walking will help you lower the high blood pressure. But if you're depressed or anxious or have bipolar disorder, oh no, that's a different story. Well, you know what? That's part of your body too. And it's as valuable as taking care of your diabetes or taking care of your high blood pressure. Ariana says, they say, just leave him alone. They will get over it. Oh, yeah, right. Thank you, Ariana, for saying that. They just have not taken their medication. Yeah. Well, let me tell you, I have a whole spill on medication. Because unfortunately, stigmas are contributing to that kind of reaction. Oh, thank you. Cynthia Van Green, welcome. I'm so excited you're here. She's sharing, oh, shake it off. Things could be worse. What doesn't kill us makes us stronger. And if that were true, thank you for sharing. And my response to the people who say that is, if that was to be true, then that means if I have depression, I can do this. And I'm not depressed anymore. So do you see? The stigma has to be eradicated. It has to be eliminated because those thoughts and those beliefs are contributing to these numbers in depression and anxiety to increasing. So we need to correct that. Mary says, I love that you are hearing from us. Truly delightful. Thank you. I'm glad. But it's because I'm here talking to you and I want you to participate and I want you to feel included and I want you to feel valued because you out there are valuable. If you're a consumer, you're valuable. And if you're a provider, you're valuable. This is not something we can do on our own. We need everybody. So I need to include you somehow. And since I cannot talk to you face to face, I have to be creative. So thank you for your words, Mary. You're making my day. And Lauranda says that in the Catholic Church, she has heard priests say, just pray, it will go away. You don't need medication for depression. Thank you for sharing that, Lauranda, because that's one of my, I call it my rants. I have a few rants. You might hear some of them today if I have enough time to share that. And what happens is that we cannot over-spiritualize. We cannot over-spiritualize mental illness. That is a theology that needs to be challenged and need to be reevaluated because when you look at scripture addresses depression and scripture addresses the way we're going to think to eradicate worry in Philippians. And scripture talks about different examples of men of God who experienced depression. And we had several incidents of people who told the Lord, kill me now. Yeah. So we have plenty of examples. However, we also have plenty of examples of how Jesus addressed these emotions and these illnesses and how Jesus was compassionate towards those who were hurting. So if we're going to use scripture, we have to use it in its entire context. Always providing hope, because that's what scripture provides. It provides hope for the hurting. It provides strength for those who are weary and for those who are tired. I mean, and when we talk about the role of the church in a minute, we're going to see how we definitely need not only the family, we need the church. We need our pastors, our priests, with theologically sound, approaches, of course. Oh, thank you, Cynthia. She's so wonderful. She says she loves, I love you all too. Mary says, because of the way the Catholic Church operates, we have to work hard to educate our bishops. Yes, and that's why we are here. We are educating ourselves. So I want to share with you the myths chart, okay? Let me go to the chart with myths, and we're going to address it here. Can you see it? Odelia, talk to me because I cannot see.
Yes,
okay,
I
thank
sure
you.
can. Thank you.
Now I cannot see anything other than my screen. Thank you, Odelia. So let's go through it quickly, all right? Myths are, I'm not crazy, so I'm not going to the counseling or the psychiatrist. Well, yes, you are not crazy because, like I said, the head is part of the body. Medications can make you addict. Well, I have a whole conference about that, but quickly, I'm just going to say that medications, when taken as prescribed, do not cause addiction. And I'm going to add something more. There is a medication specifically to address the specific symptoms and issues. Not, I always say, in terms of medication, this is not a one size fits all, okay? So one medication will not address everything. We have to be very careful and very specific when we share our symptoms with our psychiatrist or primary care physician, because he's going to prescribe the medication based on your reports on symptoms. And I have a lot of clients who have told me, well, I didn't tell the doctor everything I was feeling. Well, that's a risk, because that symptom you did not share may be the critical symptom to address with medication that will help alleviate everything else. So please be careful, all right? I have a lot of people who tell me, don't tell anyone. And I always say, you know, we have a license that we work with and that we abide by. We are responsible to the state board. I always add, I'm responsible to God first, but I'm responsible to the state board. Counseling is confidential. However, in order to get help, you need to talk to a professional, okay? We are very responsible for not only with our licenses, we are in this profession because we have love and compassion for the people with mental illnesses. The next myth is, if you have depression, you don't have enough faith. And I believe someone shared that. I don't remember if it was Mary or Kara, but Ariana. So that faith is not an issue of mental health. Faith is not depression, okay? Faith is faith. It is a spiritual aspect. My depression is not necessarily related to faith. My depression is a mental illness. But my faith in God, my faith in Jesus, my faith in the Word of God, my faith can help me overcome depression. There was a study conducted in California that indicated that those patients with depression who have faith or who had a strong spiritual support or who were connected to, a church, recovered quickly to their depression episode more quickly than others who had no faith, who had not been connected to a church, or who did not nurture their spiritual life. The next one is, I'm not going to a crazy house or a manicomio. I have had people come to my office, and the first thing they ask me, well, if I tell you what I feel, are you going to send me to a manicomio? And I said, no. Why? Because inpatient facilities are only for higher levels of care. Not everyone needs to be in an inpatient facilities, and inpatient facilities are only for a short period of time to stabilize that higher level of care. And the last one is, mental illness is the result of sin. And this is not, absolutely not true. Mental illness is not a sin, it is an illness. So let me pause for a second here. And yes, Lauranda says, a big thing is self-report. I have had people who tell me, no, when I'm doing the suicide assessment, no, I'm good. And I know they're not good. But since self-report is important, then we have to be careful with that. And the same for medication. So I want to stop here for a second to help you breathe, because I know I gave you a mouthful of information. What do you think about all these? Now, while you write, what do we do? How do we break stigmas? How do we help our families, Latinos or non-Latinos? First, psychoeducational information. Information. Repeat with me. Information. Say it again. Information. We need information. We need to educate people. We need to normalize. Okay, there's two components I want to add to information. Normalize and validate. Many people tell me, well, I'm so anxious. Is this normal? Yes, it's normal when you are experiencing significant stressors. Yes, it's normal when you're worried about your loved one. Yes, it's normal when you're worried about how are you going to feed your children and you're a single mom and you don't have a job. Yes, it's normal when you have had a loved one die and you did not even get to say goodbye. Yes, it is normal. So we need to validate that. And validating it is exactly that. Normalizing. Your feelings are validated. Yes, it's okay. You're not alone. Now that we know what we're dealing with, we need to work through it. Even like I have mentioned before, physicians who had reach out to me because they were worried they need to keep functioning in their field, and they were struggling with anxiety and depression. I had to say, yes, it's normal, because it is. But now I need you to rest a little bit so that you can keep functioning, and we're going to deal with that anxiety and we're going to deal with that depression. Mary says, NAMI, family to family and peer. Excellent. Yes, peer to peer and family to family. Thank you. Provider programs are tools for educating the people and the public. Excellent. Our programs are also in Spanish. Thank you, Mary. Olga, so happy that you're addressing this. Wonderful. Yes, faith leaders, it's okay to refer our congregants to professionals. Yes, I have in my area a lot of churches and pastors who refer members of their congregation to me, and we work collaboratively. I don't work alone. This is a multidimensional work. The church, the physician, the psychiatrist, the counselor, the family, NAMI, support system. This is a work for everybody. For everybody. We cannot do this alone. Thank you, Lauranda. I completely agree. I am a part of a Hispanic culture, and a family member of mine is big on pride and does not share a lot of their medical symptoms. It does her more harm than good. And that's why we need to talk about this. So we need information. We need to strengthen our support system. We need to promote wellness. We need to make sure that the church is informed, and we need to reframe information. For example, let's say, I'm melting here, so that's why you see me. Let's say that someone comes to you and does not dare to share their own struggle, but you see that there is something out there. You can say, you know what? It's okay. Maybe it's not you. Maybe it's a friend. And they're more comfortable talking about a friend than themselves. Well, okay. I can say, let me pick on Odilia, because now Odilia is my closest friend. I'm going to say, oh, Odilia, well, if you have a close friend who's dealing with depression, tell your friend that there is help. And Odilia may say, yes, I have a friend. And she may tell me her whole story, but it's a friend. Then it's okay. Let's help that friend. We need to continue to share these. So another thing we need to make sure is that we learn and we share that there are some there are medical conditions that sometimes can interfere with our mental health and provoke certain symptoms. For example, Parkinson's disease. Parkinson's disease is known by changing or depleting the dopamine. When that happens, Parkinson's patients may struggle with depression. And if you don't identify the symptoms and address the issue, then they may be suffering more than they should. And so it's important to say, yes, you're having this condition, but this condition causes depression, so let's talk about it. Certain cancer patients struggle with depression as well. And I see Mary says that my husband and I run a cancer support group, and I was talking to someone the other day who did not want to share her diagnosis. I'm so sorry. This problem is not confined to mental illness. Correct. That is true. And it's true, we cannot get support if we don't talk. But because now we know that people don't dare to talk, we need to encourage them to talk. I really believe, and this is something that I have read, but it's my belief. Let's empower people to talk about their mental illness. Let's empower families to talk about mental illness, because we may not be able to address it all with our family members, but we may be able to save someone. We may be able to save someone from death and encourage them to go to counseling. Maybe they're not willing to go to a counselor, but they're willing to go to NAMI. Maybe they're willing to go to a support group. And you can say, well, if you want, I can go with you and I can hold your hand. It's okay to hold someone's hand. Maybe that's all they need. And at least they're hearing information, and maybe immediately they're not reacting to it, but that information stayed in their minds. And later they can come out and say, you know what? It's been 3 months since you took me to that group. Okay, I'm ready now to go to the counselor. Would you go with me and hold my hand? Yes, I'm going to go with you. And I'm going to hold your hand. Let's do that. So cancer patients, thyroid conditions can cause some depression and some anxiety, and definitely the issues of substance abuse. Substance abuse is known to be comorbid with other conditions, and other conditions sometimes may have an impact and lead to substance abuse. I have been seeing clients who struggle with depression, and they self-medicate with alcohol and other substances, thinking that they're going to make it better. And we all know that it's just going to make it worse. But until we talk about it, they're not going to feel empowered, or they're not going to react or have that awareness. So I honestly recommend, let's bring these issues out. Excellent. When I went to NAMI's Family to Family, a close friend joined me. Wonderful, Odelia. Thank you. It made a world of a difference. Of course it does. I mean, if we don't go, you know how people say, well, women always go in groups to the bathroom, or women always go in group to the mall, or let's go in groups to the support group. Let's go in groups to, okay, maybe only one person can go to the counseling session, but they can wait outside in the waiting room, or in the lobby, or in the hall. My office only holds 3 people, but the hall is pretty big. and that's my experience, but the same with other people can have similar experiences. So one thing to consider as we are helping others is that maybe the patient may not be telling you symptoms, clear-cut symptoms. Usually they don't have the vocabulary or the language to identify symptoms that will help initiate a specific diagnosis. But the patient will be able to tell you, well, I've been nervous lately, or I can't sleep, or I don't know what's going on. I feel restless. Well, that's okay. Did you feel that before? No, I haven't felt that before since my husband lost a job or whatever. So make sure that whatever people are sharing, you have to listen for meaning. There is a meaning. It is not normal that people lose their appetite and can't sleep and lose their functioning just because. It is always associated with something. So usually people will tell you what they're experiencing, and we have to ask a little bit more. So we know now that we have anxiety, depression, and trauma-related symptoms associated. But there might be a patient with bipolar disorder who has not been diagnosed, who is struggling, and just shares what they're experiencing. Then what is the stigma about bipolar disorder? Many people who have been struggling with other situations immediately tell me, I'm not bipolar, right? Because the stigma has been so negative that they're even afraid to verbalize the word. And so what do? We say, you know what? I don't know if you're bipolar or not, but what I do know is that what you're experiencing, there is help for that. We can talk about it. We can seek help. We can go to a support group. I can go with you to the psychiatrist. I can go with you to the counselor. Let's find out first if it is or if it's not. And if it is, there is treatment. There is support system. We can work together. We can do something to help you. Okay? So just make sure that we demystify all of those concepts. Empirically supported treatments are treatments that have gone through different types of research and consistently indicate that there is significant improvement. One of those top number one treatments are counseling and psychotherapy. So what do I do if I'm depressed? Counseling and psychotherapy will help. Support groups. There is a specific form of psychotherapy that consistently research indicates that is the treatment of choice for decreasing symptoms of anxiety and depression, and it's cognitive behavior therapy. Let's go to counseling. Oftentimes clients tell me, they ask me, well, what do you do? Do you talk? Yes, you just talk. I'm going to do the work. Joe, just don't worry. Let me handle it. You just spill your guts. That's what I tell them. And when I say that, do you know what I see? They're like, oh, okay. And they just begin to talk. Because it's true. Your job is to talk. I'm going to do the work. I'm going to hold your hand. I'm going to help you. I'm going to guide you. I'm going to facilitate the process. The second form of treatment is support. Support group and spiritual support. Positive social support. There is another research that I found that measured support, social support, and in negative social support and positive social support. And those clients who indicated positive social support recovered quickly and for a longer period of time achieved remission than those who had negative social support. Have you heard about people saying, yeah, don't get close to negative people, or stay away from the mala vibra, or yeah, that person is too negative? Now, research supports that. Positive social support, quicker recovery, longer remission periods, stabilization of symptoms at a higher rate than those with negative social support. Now, medication management. So let me talk briefly about medication management, and I know the time is running, and I want to have time for responding to some questions. And I talked a little bit about medication before, but remember that we have different hormones that manage mood and that manage anxiety and depression. Dopamine, norepinephrine, serotonin, and others, endorphins. So the way that I describe it is, imagine one of those printers that had like different tubes with ink. I mean, I don't know if they still exist, but imagine just tubes with ink. And you're wanting to print and you ran out of the green and the red, but you still have blue and yellow. Well, those hormones are like that. So I cannot prescribe one medication that will refill all of the colors because not all of the colors are created equal. Not all of the hormones do the same. Not all of the medications will take off dopamine, serotonin, norepinephrine, and endorphins at the same time. That's why we need to be careful. So medication management, and hear me say the word management. If you don't have a medical degree and you're not a psychiatrist, you cannot manage medication. So don't dare to say someone take this or don't take that or take it this way or don't take it that way, because that person could be at risk. Okay, there is a psychiatrist for that. There is a primary care physician for that. Okay, so promise me you're not going to do what people say. Oh yeah, my doctor prescribed it, but I didn't take it. Or yeah, I took it, but I felt better, so I stopped it. Without the management of the physician, we are running risks. So please be careful with that. And now I'm going to go and talk about the basics. And this is hilarious because every time I talk about it, people laugh. And I always say the same joke. I know if you have heard me before, you have heard it, but you know, there's some people that may be here for the first time. There is one free, no cost activity that is the number one activity to manage mental health. Guess what? I'm not going to say it yet. Just write it on your chat. Say it. You know which one it is. Say it. Say it. Do you dare to say it? Sleep is one of them. Sleep is one of them. I'm going to give you the 5 basic naturals, but sleep is one of them. And with patients with bipolar disorder, thank you, Melissa and Odelia. Exercise, Linda said it. Good nutrition, Mary, thank you. So we have 5 basics. Exercise, sleep, good nutrition, water, and sunlight. I was going to say something about bipolar disorder. When you regulate sleep on bipolar disorder patients, 50% of the cases immediately begin to stabilize only by regulating sleep. And when you regulate exercise, good nutrition, you drink water, and you have proper sunlight. I don't want you to roast outside like a chicken, all right? We're not talking about that. I just mean go outside, open the windows, just have some sunlight. When you take care of these 5 basic naturals, you are beginning to stabilize your mental health. And then we can see the baseline, and then the doctors can say, okay, she needs this medication or she needs that medication. Or you know what? She doesn't need medication, because 80% of the time, most of the cases of depression and anxiety can be alleviated with counseling if there are not any other issues. So exercise, sleep, water, good nutrition, sunlight. All right? Excellent. Let's talk about the role of the family, and then we're going to talk about the role of the church, and I'm going to take questions. The role of the family. Talk, but also listen. Have you all seen the viral video in YouTube of this little boy that says to the mom, listen, Linda, listen, listen. Have you seen it? If you have not seen it, go to YouTube. I mean, I'm not advocating for anything, okay? If you have seen it, isn't it hilarious? So I'm going to say to the family, listen, listen, Linda, listen, honey, listen, listen. Why? Because we need to listen to our loved ones. We need to listen with love, and we need to listen with empathy. Please use empathy. Don't judge, don't criticize. Listen with love and empathy. Get information from the professionals, not from Google. That's all I'm going to say. Professionals are there for a reason, all right? Get information from NAMI, all right? NAMI is your friend, all right? seek support and definitely seek professional help. Now, let's talk about the role of the church. Like I said before, the support of the church is critical for families of mental health patients and for mental health patients. There is a research conducted this past year during COVID, that indicates that religious support contributes to face the effects of social isolation in mental health during the pandemic. Someone mentioned before Zoom, and our churches had to be creative to conduct Sunday school, mass, Sunday schools, Sunday services through Zoom, to keep people connected, to keep people with hope and hearing the word of God and just bringing a word of hope. This particular research indicates that they provided a more positive, optimistic worldview. It improved coping with acute and chronic stress. It ameliorated effects that stress caused in the immune system, and it reduced the sense of loneliness by establishing connections. That's the role of the church, to love on people. So I know I was going to mention briefly about the barriers, but I'm sure you know them. I want to provide resources. So the first resources I have, NAMI is our first resource. In Bexar or Bexar County in San Antonio, we have one that is called the Bexar County Resource Directory. We also have Urban Strategies. We have STCH Ministries Family Counseling. We have the National Suicide Phone Line, and we have the Spanish National Suicide Line. We also have a crisis text line, and that one is you text HOME to the number 741741. And there is a LGBTQ line also, and you text START to 678678. And this PowerPoint is going to be available and with those resources. So just to summarize and allow for questions and having some time of more direct conversation. As terrible as the pandemic has contributed to the increase in symptoms of mental health and mental illnesses, we also have found that support and talking and being present, even virtually, has significantly contributed to improvement and hope and help. We just have to dare to talk about it. We just have to dare to address the issue. And we just have to dare to do what no one likes to do, which is, let's bring up this issue. Let's remove the stigma of the elephant in the room and let's address the elephant. Now, let's do it with love and empathy and kindness. I can say, Odelia, I see you sad. Or I can say, Odelia, I see you worry. I care about you. Talk to me. What's going on? Now, for those cases with the juvenile probation, I go to the parents and I tell the parents, it is in your hands to help your child. Children are not lost if we don't let go of them. They may be difficult to work with, I know. They may be challenging, I know. But let's involve the family, okay? So this is something we can do. Having male peer support specialists would help with males overcome the stigma, feeling and accepting treatment. I agree with Lonnie. Thank you, Lonnie. Thank you. We need more men in the picture. We need more men in the picture. Absolutely. Male peer support. So thank you so much. I know we haven't finished the session, but I want to take questions. Odelia, You are the woman of the hour to help me with that.
Dr. Davila, at the present time, we don't have any Q&A
Okay.
in the box, but I
Okay.
just wanted to share that, people will never know how you feel unless you tell them. And that's
Correct.
something we need to address, because we want to help, but you need to be open to share.
Absolutely. We need to be open to share. I have heard people very often tell me, and they take it to pride. They say it proudly, saying, well, no, I don't talk to anybody. No, I don't have any friends. I don't need any friends. You know what? That's not true. God created us relational beings. That means we need people. We need somebody. We need someone. We need to be able to be open to share. Now, in confidence, of course, not everybody may be trustworthy, but if you find a godly person who you can trust, if you find a friend who's a trusted friend, and like I said before, professionals, let's be open to talk about it. A lot of times, people with one session have told me, I didn't know how much I would benefit from coming to counseling by just sharing. Yeah. I see Analicia says, what have you done in Fort Worth to reach the Hispanic community that could be that could be replicated in San Antonio? That's a great question. In Fort Worth, I am actively involved with the mental health organizations there, with schools, with churches. I am a part of the Taram Baptist Association, which is my county. I meet with pastors. Pastors know me personally. I attend their meetings. They ask me for conferences to their churches, and I go to their churches to bring information. So I'm available to them. And of course, because I am available, any opportunity that I receive from either Telemundo or in my case, I'm a Baptist from the Baptist Convention. I am actively involved with the community, with the schools. I am actively involved with the elementary schools, and middle schools and high schools call me less. Elementary schools call me more for some reason, to prevent and to educate parents. So that's what I do. I stay connected with the community. I see Cynthia agree, and we need to agree to do random body checks. Yes, because maybe the sharing will come out, especially for those you think that may be in need. Yes, thank you, Cynthia. Martha, your presentation is covering so many critical points and learning how to address them. Everyone's comments have helped too. Thank you all. Great conference. Great experience. Thank you. Thank you, Martha. Thank you so much. Anyone else, if you have a questions, please feel free. We have still 7 minutes. This is a miracle because those who know me know that I could keep talking and sharing information until there is no more time. But I am well behaved because I want to be invited again.
Dr. Davila,
Yes.
what can you say regarding parents that feel guilty, so guilty, because they've lost touch with their loved one that battles mental health in another city?
Yes, that is a great question, Odelia. Oh, when I'm going to go in the preventive side, and then I'm going to go with what you mentioned when they have lost touch. On the preventive end, I always say nurture and protect your relationship with your loved ones. Because when you nurture it and you protect it, even if your family is under an episode that they have lost touch with reality, or they are just isolating and hiding, one day at one point, they know they can trust you and they will reach out to you. So you need to develop those connections. Now, if the loved one has moved to a different city, try if you can to reach out, whether Facebook, Instagram, email, text, a friend of a friend from long ago, so that at least you can connect, and you don't have to explain anything other than, I've been thinking about you, I love you, I want to stay connected with you, how can I be of help to you? You don't need to question, why have you called? You don't need to make the other person feel guilty and go into more isolation than they're already going. Just be available to them and make sure that they know you're available to them, so that when they're in crisis or when they're in that dark spot, they know they have someone they can go to. And then we'll deal with the rest. But those are the two major points that I will say.
Thank you so much.
Absolutely. We have 5 minutes. So any other questions, any comments, any doubts?
Okay, Dr. Davila, let's go ahead and have you share some closing thoughts. I know that your presentation was just very valuable, and all the different things you touched on and sharing those 5 basics with us, those are great takeaways. I truly enjoy meeting you and hearing your great message and information.
Thank you. Thank you so much, Odelia. I think my last comment would be, first, God, pray. Pray, because God still has control and God still can heal. And God heals in different ways. God heals through support groups, through physicians, through counseling, through scripture. So let's not limit God. And then the second one, as a family or as a friend, be available, be willing to love, but please be empathetic, be compassionate, avoid any judgmental or critical remarks, because they don't need that. They already have that of their own. So just please continue to be empathetic and seek help. Reach out. NAMI is here to help. So many providers that we love and have passion for this field and for this population, and we feel a calling from God to minister in this capacity. So just make sure that you reach out, seek help. If you haven't dared to say anything, if you haven't dared to reach out, please do so. Your life is valuable. You are valuable, and you are valuable to God as well. So God bless you. It has been a pleasure being here with you. Thank you for what you do, to all of you at NAMI, Odelia, and all of and the community. Thank you for all of what you do. There is a phrase that says, "It takes a village to raise a child." Well, it takes a village to keep our community healthy. Thank you.
Absolutely. And I think everyone concurs with me that when I say how appreciative we are of your time and all your amazing, incredible knowledge. For participants, thank you for participating in our conference, and thank you for attending this workshop. You can find a recording of this workshop on the NAMI San Antonio YouTube channel. If you would like a copy of the slides, you can find them on the Pathways to Hope website after the conference. When you close out the session, a post-workshop survey will pop up in your browser. We value your thoughts and will use the feedback that you provide to shape all future conferences. It is also required that you complete a survey if you are seeking the CEU for this workshop. Again, thank you all and have a great rest of your day. God bless.
Thank you, Odelia, for your help today.
Welcome.
Thank
Have a
you for
blessed.
being here. Thank you for both of you.
Thank
you,
you.
Gina. Thank you so much for your assistance, Gina.
Thank you for everything you did. Appreciate you.
You're
Thank
more than
you.
welcome.
Bye-bye.
Bye.
Bye.